It seems like it's been 40 weeks since you got 40 winks. Your back pain? Unbearable. Tossing, turning, trying to find that pain-free position. And that's the moment you realize you can't spend another waking moment putting off treatment.
The Joint and Spine Center is Cincinnati's leading destination for spine care, with a ton of surgical and non-surgical treatments for back pain. So when a moment has the power to change the rest of your life, go to the one place with the power to change it for the better, the Christ Hospital Health Network. This changes everything.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 620, Taking Care of Your Mental Health with Dr. Monica Sullivan.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
Thank you so much for listening to the Pound This Podcast. I am Amanda Valentine. Returning guest today is Dr. Monica Sullivan from the Christ Hospital. How are you?
I am great, Amanda. How are you?
Good. So last time we chatted, which we were just mentioning before we started recording, was at the very beginning of the pandemic. And we're like, wow, the world is much different this time that we're talking.
Yes, it is. It's different, and there's been some good and there's been some bad, but we're we're definitely in a good place here, I think.
So I definitely want to get into the topic of mental health with you, but to give everybody an idea of who you are and where you work, well, tell me all about you.
Sure. So I am a family medicine physician. I work with the Christ Hospital Physician Network. The Christ Hospital is in Cincinnati, the actual hospital itself, but my actual practice is over in Northern Kentucky. I've been there for about 3 years, a little over that at this point. And we see all sorts of patients. We just have a normal office. We see everything from newborn babies all the way up to, I think my oldest patient is over 100 at this point. Yeah. So, and everything in between. One of the very special blessings about primary care and family medicine is that I do take care of whole families. So I have great grandma, great grandpa, grandma, grandpa, mom, dad, son, daughter, and then the grandchildren and great grandchildren as well. So it's such a privilege. It's a great network to work for. Christ Hospital is incredible. So that's kind of where I work. I work near the off of the Buttermilk exit over there. There's a few other offices in Northern Kentucky, but most of the outpatient offices are over in Cincinnati.
So since the last time we talked, I mean, outside of, actual COVID-19 concerns, over the course of the past year, what have you seen people coming to you about, and like the repeated patterns? Is it mental health, weight gain? What are the things that people are most concerned with right now?
Yeah, and that's such an interesting question. Last time we talked, we were right at the beginning where do we even know where we can get people tested for the coronavirus? What's going on? Like, are we going to go to school? Are we going to be in the office? So all of that, kind of progressed into, we were back in our office. We never really shut down, but we saw everything from checkups to what kind of sick visits, meaning coughs, colds, urinary tract stuff, all of that we were trying to kind of keep very consistent for patients. Meanwhile, developing a place where if you thought you had coronavirus, we had a separate respiratory clinic to kind of see and evaluate people in a way to keep patients safe. And so that was the beginning. Then as the things kind of settled down a little bit from that standpoint over the summer, what I then started to see was just kind of the fallout. People did a great job of handling their first few months of the pandemic, whether it was change in work, change in home, change in kids' schooling, mom, dad, everything. Then it was kind of all of those changes caught up to them. And I started to see a lot more anxiety, depression, absolutely weight gain, fatigue, extreme fatigue. People were just very tired and still are very tired. And then as that kind of progressed over the summer to still continuing to see those sorts of issues, along with more of people are starting to take a hold of their health now. So they want to come back in for their checkups and physicals. In addition, I haven't seen a lot of these people in the office. So they're telling me about all the changes they've seen and how it's affecting their mental health and their physical health. And then to now where we have the promise of, a vaccine and more changes coming our way. So the progression from beginning of pandemic to now has been quite interesting.
Yeah, for sure. And I mean, I, have gone through, or I'm still living through, some mental health effects over the past year. And I've been seeing a therapist, and I was at the point for me that this is where I knew it was something more than just like, hey, I'm bummed out, this stuff sucks, is that it felt like the color was drained out of life. Like the things that I
Yeah.
normally love to do, just even like going for a walk, I just didn't want to do anything. I mean, like, it's so much not like me at all. I just felt like a zombie. I didn't want to get out of my clothes. I just like it's just like eating, not even to make a COVID reference, like just eating your favorite food with no flavor to it. And you're
Right.
just getting through this, and like it's just, I'm like, I hate this. Like, I don't know, I feel like there's no motivation, I don't feel like myself. And so I was recommended to start antidepressants, and then I saw my primary care physician at Christ Hospital, and he also recommended going on antidepressants to try to fix this. And I'm like, I had no idea that I could go to my primary care physician and have this conversation. I don't know if that's just me or if that's common, but I was like, oh, I didn't realize I could see my primary care. I could have wrote you on my chart and said, this is how I was feeling. Can we have a conversation? And he could help me with that. Now that to me was eye opening.
Yeah, and I didn't even realize how common that was, to be honest with you, until some of these things started to come up. I have patients I see multiple times a year if they have significant medical problems. And I do also have patients I see once a year. They just come in, we talk about how their last year has been, we figure out best ways to evaluate and keep people healthy. And this is the first year that when I've asked patients, how is your mood? How are you coping with everything that's going on? How many of them did kind of look at me with a puzzled look and they said, oh, I can tell you those things. And of course, mental health is a huge part of your overall health and wellness. And I am so glad that patients are reaching out because it may not always need counseling or therapy and medicine, but the idea where they feel comfortable enough and we can have that conversation and, really kind of dispel some of those myths. If I'm on this medicine, then I'm really messed up, or if I take this, then this will happen and I'm never going to get off of it. But having a chance to talk with people about generally how they're feeling and then helping them figure out what's going to work best for them to get them back to activities that they love, being excited to wake up in the morning, taking walks, food tasting good, and getting that motivation and that kind of like a zest for life back. Like you said, you were living in a very like non-colored world there for a while, and that affects you, it affects your family, it just affects everything. And those are some of the hardest things I think to talk about with patients. But the beauty of primary care and knowing your patients and their families is knowing that background and being able to have that trusting relationship to help them through it.
So at what point would you, or I don't even know if you can answer this question, I know it's so
Mhm.
case by case, where you're like, okay, we need to prescribe a medication for this?
Mhm. Yeah, and in general, like you said, case by case, it's different. But in general, what we start with first is a conversation. What are you feeling? Is it just in this part of your life, or is it home and work and with your kids or family? How many environments are you noticing this kind of lack? Is it affecting your daily life? Meaning, are you staying in bed, not getting dressed, not making it to work meetings or, keeping up with your family responsibilities, whatever those look like. And the minute it really starts to affect all of these areas of life is the time that we really need to intervene, and first start with how comfortable are you about considering a medicine, or what things have you heard about medicines like these that scare you? Is anybody in your family on a medicine? What worked well for them? really, when patients are bringing it up to you in general, there's something really going on, and other people have noticed, hey, my wife is really just not herself, and I'm really worried about her. Um, when other people are noticing too, then you need to get a little more serious about more aggressive things like medicine or, getting somebody involved with a therapist or counselor, things like that. Other patients, if they just talk about it and you develop a plan of, okay, we're going to try some meditation exercises, we're going to try a week of some structured exercise, some activities that you like to do. Let's give it a week or two and see if that makes any difference. And if those things kind of don't work as well, or we're not getting a big effect out of it, then maybe it's time for some medicine.
And I'm sure my experience will probably echo some of the other patients you've had where, one, I'm just like not a medication person. I mean, I had to ask my
Yeah.
doctor, I had to ask them, I'm like, I don't know how to refill a prescription. How do I do this? They're like, oh, call the number on the thing. I'm like, oh, and they're like,
Yeah.
well, good for you that you've never had to get a prescription refill before. But like, I just, don't take much medication if I can help. And so I was worried about that. And I was worried, I'm like, will this make me gain weight? Because if I gain weight on top of this, that's going to further my depression, to be honest. And do I
Yeah.
have to be on this forever? Can this just be something until I am, feeling better, feeling like myself, and can I fade this out again? I don't want to start something that I'm now chained to for the rest of my life.
Right. And that those are some of the biggest when I ask patients about what their concerns are or what they've heard, what scares them about potentially starting a medicine, those are really what comes up. I'm not on medicines, I'm really sensitive to them. I'm really worried if I start taking this, I'm going to have some side effects. So we go through those, what to expect the first week or so, and then after that, and what they can expect to feel like. And then how it works with I'm going to electronically send this to the pharmacy. You'll get a phone call, and you can pick it up in about an hour, that sort of thing, and how to refill it. One of the bonuses about everything is now patients are getting so much more used to electronic, messages where they can send me what we call my chart message. So if they start the medicine and they're feeling something or they're worried about something, they don't have to call specifically. They can send me a message through the computer that says, hey, I'm worried about this. And I can respond to them quickly and just kind of manage it. Not so much like I'm starting you on a medicine, let's talk in 6 weeks. It's I'm starting you on a medicine, let's keep the conversation open with how you're feeling and what changes you're noticing. And then, to the last point, having like weight gain or some of those things, any chemical, whether it's an antibiotic or antidepressant or some of these things, any medicine that you're putting into your body is going to have some side effects. And the most important thing when you start medicines is you want the lowest effective dose. So you don't start a patient on a high dose of medicine right from the get-go. You start on a teeny tiny amount, and you keep discussing, am I better? Am I not? I'm somewhat better. We need to increase it. And usually that really helps with avoiding the weight gain because as people feel better, they also start exercising more. They also, they start sleeping better, that sort of thing. So those other determinants of health really change. And the idea would be to keep somebody on it as long as they need the medicine. My hope is that we get through whatever crisis or whatever change or whatever situation, and then we can have that conversation. Hey, it's been 6 months. How are you feeling? Do you want to maybe try to decrease the dose? Do you want to see how you feel coming off of it? It's that constant evaluation. I think that is really important, which has been greatly helped by the whole electronic, being able to care for my patients electronically. I can check in with them much more quickly versus just these episodic things every few months. Now it can become just a rolling conversation.
So, as far as the weight gain goes, do you usually find that it's tied to mental health and depression, or are they two separate categories of you're gaining weight because you're not feeling like yourself, you're depressed, or you're just gaining weight because we have this whole new way of life and it's hard to transition into this new way of living?
Yeah, it's exactly like you said, it's kind of a vicious cycle, right? So you're bummed out, you're not doing great. There's a lot of change. Our schedules, how we work, where we work, when we work, kids schooling, family obligations, all that's changed now. So, are you, not eating like you used to? Are you not cooking healthy foods? Are you snacking more? I mean, I know my little dude, the first day he went back to in school schooling, he came home and he took a beeline across the house to get to the refrigerator. He'd been used to being home and just kind of snacking throughout the day, whereas at school they eat one meal. So all those changes definitely play into this. And so the more kind of out of whack you feel with your health and diet and exercise, the more depressed you get. And the more depressed you get, then you start gaining weight because you're not doing all those things. And I should say it's not just depression, it's anxiety. It can be a mixture, but really it all plays into each other.
And since you mentioned earlier that, since you work in family practice, you deal from infants to people over 100 years old, are you having these conversations with kids too?
Yeah, yeah, and I will tell you, it's been a daily conversation in about half of my patients in some way, shape, or form. Whether it's, hey, I'm not adjusting to the pandemic. It's 2021. I really want to get healthy. How do we go about doing that? And because the parents, and with everything going on, their lives have changed significantly. I'm having these conversations with the parents as well as the kids are very resilient. They're adapting as well as we can expect, but they're still having some, change anxiety and some little bit of depression. And also their eating habits are way off too. Their whole schedule, their sports, a lot of kids get their usual activity from sports, which for a while that wasn't happening. So, when we talk with mom and dad with the child in the room, those are questions we ask, like, how are you sleeping? How is your eating going? Do you find yourself eating too much or not wanting to eat? Are you doing okay going to bed? Or are you laying awake at night, trying to figure out how the next day is going to be? But yes, kids are generally healthy when they come to see me for their checkup. So this is much more of the time we spend during the appointment, kind of figuring out how the teachers feel the kids are doing, the parents, as well as the child themselves.
I mean, I know that this is all, not a great time to be through and we're all dealing with those things, but I think it's also positive in that we are having these conversations of, where you're talking to kids and families and let's focus on how we can get healthier. I mean, in my perspective, which I'm not a doctor, you tell me I'm wrong, it feels like this feels like more of a prevalent conversation today than it was in 2019.
Yeah, yeah, it really is. And what makes me really happy about all of it is parents and the kids are much more open to it as well, because some of the stressors have changed. They've had to rely a lot more on technology, on learning how to email their teachers, learning how to incorporate non-traditional gym class into their day at home. But it's been really fulfilling for me that the kids even feel comfortable asking me these questions and bringing it up. And then some kids, we need a little bit more help, maybe some counseling or just talking with the teacher or bringing in the other parent or somebody else involved to kind of get things addressed and get them on a good plan. Sometimes it's just consistency with kids. Like, for a while there, we were watching the news every week to figure out whether or not the kids were going back to in person learning in the school. Now it's not a week by week thing anymore. Now there's a plan in place. The kids have figured it out. They know how to turn on their computers. They figured out Google Classroom. The teachers are more comfortable. So, but the conversations surrounding mental health and general health and weight and things like that, it's wonderful that it's much more prevalent than it was in 2019.
So for an adult that might be listening to this podcast and they're wondering, they're feeling like bummed out, they're stressed, you have anxiety because just everything is how it is.
Yeah.
Like, at what point what are the signs to look for to be like, you know what, I need to contact a doctor?
Yeah, and it's, you brought up all the things I generally ask about, even in your description of how you were feeling off, just what parts of your life are being affected, right? You just kind of felt like you were in this gray zone. You weren't really wanting to do any outside activities, things that usually brought you joy. You were just kind of like, oh, I don't know. And definitely you start to feel those things, right? Your heart rate starts to go up a little bit. You have that feeling of dread, like, I just don't want to do this today. Your sleeping may be very different. Either you're wanting to sleep all day long or you're laying awake at night just worrying and worrying, or you can't fall asleep. Um, feeling guilty that maybe you're not participating in things that you usually would, not volunteering at a place and you feel guilty about that, or maybe you're not spending as much time as you would like to with family. So definitely it's energy. And when your energy is nothing, all these things are kind of at least discussions to bring up and say, hey, I have noticed that I'm just not me. That's enough when patients call me, I'm not me. Okay, why not? What's going on? And then I can kind of tease those things out to find out what all is being affected and then decide on how we can get that patient back to where they want to be.
I also feel like there's, I mean, at least I felt this, like a guilt spiral that gets attached to that of like, oh, people have it so much worse than me. People have lost loved ones.
Mhm.
People have lost their jobs. People are losing their apartments and everything else that's going on. And you're like, oh, but I'm just here worried about my thing. And that's small potatoes, and then it feels like
Mhm.
you don't get help at all because then you're comparing your pain and suffering to other people's.
Yeah, and that can be really dangerous, like you said, because you do need help. Your world and your perspective is not right. And it's really hard to compare with people because, it's like comparing apples to oranges, right? But anything that's important to the patient, to their family, to whatever makes them tick is also important to the doctor, and yeah, but everybody's different. The struggles are different. But again, just that, oh my gosh, I'm not me. And it's good that people are looking, oh, I'm grateful because I have XYZ, but my world is still not right now. Um, so I tell people just self care is so important. It's not a selfish thing, it's self care. You're thinking about your own health, your own wellness, so that in turn you can take care of other people who may still continue to struggle and you have the ability to help them.
Definitely. And I think it's just also important too, and I'm so glad that we're having this conversation, is just, as either people maybe didn't know or a reminder that you can talk to your doctor about these things. I feel like because we're in such an online world, we look for quick fixes online or to somebody that's an influencer or we follow or one of those things to like reach out to try to solve some of our problems when it's like, oh, well, if you have a family doctor that you've already know and they already know you can go to this person and have these conversations before maybe reaching out to these outside sources. And it feels like for a lot of people, we get wrapped up on trying to find someone else. You know what I mean?
Yeah, yeah. And, but I think it's easy to get overwhelmed with everything that's out there. Whether Google your symptoms or Google a depression anxiety questionnaire or put in your symptoms and it gives you a diagnosis, right?
Yeah.
One of the cool things is that we are so available to our patients. There's the traditional call the office, hey, I want to see my doctor today. And the receptionist says, okay, what would you like to come in for? There's that. And then there's, scheduling an e-visit online, or there's, hey, leaving a message with my medical assistant. And the My Chart is magical, just because, again, they don't have to reach out. They get a pretty quick response, like within a couple of hours of, hey, oh my gosh, I'm so sorry you feel that way. So glad you reached out. What can I help you with? What conversation, do you want to have surrounding all this? And being that accessible to patients is, I think, hopefully encouraging them to come to us first. That's what we're here for. You know, Not everybody is perfectly well and not everybody has the worst disease on the planet, but this is daily life on life's terms. And I would hope that the patients, before they even are like, I'm going to go to Google, I would hope they think, oh my gosh, I need to call my doctor. I need to talk to her about this stuff like right now.
Well, there's also, I feel like, a fear of doctors. At least my husband has this of like, I don't want them to tell me something's wrong. So I'm not going to go to the doctor because they're going to have bad news.
Yeah, yeah, and I have a lot of patients who are kind of like that. They avoid blood work, they avoid this, and in general, when they come in and they have that kind of not standoffish, that's not the right word, but this kind of like they're looking at me very skeptically. I'm like, you know what, whatever it is, we're gonna get through it together. We're going to work as a team, and we don't have to build Rome in a day, right? We may see one thing on these blood tests that we just need to work on. I don't expect instant results. We just need to come up with a plan so that 10 years down the road, worse things aren't going to happen. So we try to make the environment as comfortable as possible. And I have many patients who are much more comfortable just having the conversation over the phone or online versus a face-to-face. And then once they see that this is a really benign situation, most of the time then they'll come in and they're excited to see me. And I'm not going to tell them a million things that they need to change or do differently. Because really it's their world and they need to figure out how they want to live it and how to be their best selves.
Yeah, that's awesome. Well, I appreciate you so much for sharing. I mean, I might make you my doctor.
Oh, I would love that. I would hate to steal you from somebody else, but I'm happy to do that.
Are you accepting new patients? Is that something that people can like reach out to your specific office for? Like, how does that work?
Yeah. Oh, of course. The beauty of primary care is, there's not really a way that we close practices because we there's so many people that need to be taken care of in a primary care way. But we will always accept new patients, me specifically. The only time people kind of slow down their practices is, if they're working towards retirement or whatever. But generally, and this is, I can say for Christ Hospital, the majority of offices are accepting new patients pretty much all the time. So you can I know it's easy to go online. You can go online. You can search primary care doctors. You can click on the pictures. Some of us have some videos on there, a description of, what we're interested in. You can call the office. We've tried to make it as user-friendly as possible because the bottom line is we just want people to come in and get good health care and develop that relationship over a long period of time.
Yeah. Well, I think it's awesome. You can obviously just tell from listening to you how much you deeply care about what you do and your patients. And I appreciate that so much. And I know I said this is the last our last podcast together. And obviously I mean it. You are welcome back anytime.
Well, thank you, Amanda. I would come on every week, honestly.
We can do that.
It's fun. Yeah. It's fun to find out what's going on in people's worlds. And honestly, I learn a lot from you. Every time I talk with you, I learn a lot about what's going on out there. To me, it just seems like, oh, I'm not feeling great. I'm going to call my doctor. I had no idea that there were so many people out there that just didn't think to call us first, even with mental health stuff. You don't need to go to a super specialized, psychiatrist or a therapist or anything. We can at least get you started. We know you the best. But really, Amanda, thank you for what you do. I learn so much every time I talk to you.
Oh, thank you. I appreciate it. And hopefully we will be talking again soon.
Yep, absolutely. Thanks so much.
For info on health coaching and more, go to AmandaValentineBites.com.